I'm Dr. Supreetha from Hyderabad. Sir, I have one question that we are planning for OPU. Today we have given trigger, sir. After 34 to 35 hours, we are doing OPU, sir. We are not finding any follicle. So, on table cancellation, how we have to counsel the patient and what is the cause of that empty follicles? I mean,
It's not empty follicle. You have not found
no,
an egg or
no
follicle rupture.
follicles. But at the time of trigger, I have a good number of follicles.
हाँ, so इसके अंदर what is there are two ways it can happen that this is a common problem again, and this I again look at you in case you don't get angry with me.
No, sir.
When we are reporting channel, na, when we are sitting on one room and you got 30 gynecologists all over the country in their own little centers reporting तो क्या होता है? You know, it's a teamwork. Once a girl in Patna, now in your organization only in Patna, her first case, she calls me. I was guiding her about the first case for her and my fourth center at Patna. She was saying, "Sir, I'm not comfortable with this particular drug, some brand of Cetrolix." I said, "No, this is a good brand. You in corporates we follow a pattern. You have to buy that drug only." And in the morning, first pickup of her carrier, after 10 months of training and learning, she put the foam inside and no follicles. Same thing. And she fought with me in the morning. Sir, I told you this drug is, you are promoting a wrong company. It's not a good company. I've learned. I said, yeah, relax. I also know my job. Sir, you gave a wrong trigger. You should have changed the company. See what has happened. No problem. So I sent them the breakfast. Actually, it happened. I sent them the litti chokas and some jalebi. I had a small party for them. I said, okay, failure is a failure. We'll do the free cycle for them. That's no problem. Then he said, now you sit down peacefully and get their husband and wife and mother on the screen. And I'll talk to them. And I'll promise them that we will do 2 IVs free for them. That I could do. Within half an hour, I could find out there were winter days. Trigger had to be taken in the night at 12 o'clock. They had taken at 8 o'clock only.
Before only they have the timing.
So it is always counseling. Patients को समझ ही नहीं आ रहा है 34 का विंडो पीरियड क्यों होता है. She said, सर्दी बहुत हो गई है. कौन रात को 12 बजे जाके लगाएगा? She took at 8 o'clock only. लगा टीका तो लगाना है, लगा लिया ना टीका. In the morning she comes for a rupture. That is number one. So you have to counsel them. How do you counsel them? Right time under video surveillance. So after that I ensured in the group that every trigger is given even at home or from anywhere under video surveillance. Now we are not monitoring that we are not allowed to monitor. But opening the fridge and taking it out, the nurse sees 1 बज गया, टीके पे साइन कर रखा होता है उसमें. So मेरा signed injection है nurse का, and anybody is giving it. And we see how it has been given. At least we know the time and the injection and the right way. Now you have given them a subcutaneous. You give them Ovitril, which is subcutaneous, and they take it intramuscular. Then again, efficacy will go. So main problem here, beta, is about
Timing and
what time she takes. And so that video surveillance is what I have started now. That gives me enough. At least timing is sure. The mode of administration is sure. We don't actually watch how it is being given. That we should not watch also, but everything else we watch. Nurse watches, not me. Second problem can come is that in case she is a poor responder, then do the pickup at 17-18 millimeter only. Then go to 20. Then don't go to 20 millimeter. Pulling a follicle of 17-18 millimeter and giving her a trigger is the right option for a poor responder. Or you take them to 20-22 millimeter because you trigger at 20. Next day, 22. Next day, 24. You're triggering at 24. You're breaking at 24. So they rupture. So it's a very common thing that they rupture when you are triggering a poor ovarian responder. So in a PUR, trigger at 17 millimeter.
17 to 18.
Two things which I can tell you in your answer.
And is there any significance to aspirate fluid from the POD, sir?
You have no alternative. But how many can you get? I have done it so many times. 7, 8, 10 follicles break. How many will you get? आप बोलो कितने मिलेंगे? 1-2 मिल जाएंगे. You can't get 7, 8 because the bowel is moving, no? Bowel is moving, it will, and they are like protein shake. अब देखो
Albumin.
how is the protein shake? देखो in the hands. You must learn how to throw, catch. Yes, now throw. जोर लगा के. I caught well. Protein shake. They are so sticky. The cumulus complex is full of
Protein.
hyaluronan. Again,
I'm sorry.
तेरे सर पे पड़ने वाली है. Hyaluronan, and hyaluronan is like glue. It stick to any surface which you have. You can't get many out of, but you can do poke and take whatever you can do. But do poke, nothing wrong, because they're at right temperature, right pH, get few eggs, good.
So the same scenario, one side you have taken the follicles and no eggs were formed. Maybe the trigger might gone.
Yes, yes.
You re-trigger and then we can do the
Out 30 hours.
after
30 hours.
30
So
hours.
yeah. This thing, what we do is that the re-trigger is done after 30 hours. The reason being, otherwise follicle, why are we giving a trigger? Trigger we are giving for two purposes.
Maturation.
Maturation of the
Maturation
cytoplasm
of
and
cell.
nuclear maturity, and making the follicular wall thin. And soft. This thing will happen at 14-15 hours only. Because I give a trigger, the moment LH peak starts occurring, within 14 hours, cytoplasmic nuclear maturity occurs. That maturity is done. Rest all will be softening of the cumulus complex and lot of chemotoxins, chemotactic agents are formed. So if you do the pickup at 30 hours, so अब तुमने क्या किया? In your case, you give a trigger today at 20 millimeter, approximately 20 millimeter. Today is 1st of March. 3rd March, she does the pickup. Empty. By that time, 20 has become 23 or 24. Empty. Now she triggers again. That 24, 23 will become 27, 28. Right or wrong?
Yes.